So currently, as a physician uses regorafenib in colorectal cancer or in advanced HCC, the main issue we have is possible toxicity with regorafenib. Therefore, even though the recommended dose is 160 milligram once a day with the 21 days on with 7 days off, because of toxicity, sometimes doctors start at 120 or even lower than that. However, the main issue with starting lower doses is that are we compromising the efficacy? That's the main question that we deal with, because most of the patients, especially in colon cancer, they're only on it for 2 months at a time. Therefore, based on the abstract that was presented at the 2018 GI ASCO called the ReDOS study, in that study, the investigators randomized patients to dose escalation 80 milligram once a week to 120 the next week, 160 full dose, compared to 160 milligrams with other arm. And in that study, it showed that two things. Number one, it is feasible to dose escalate from 80 to 120 to 160. And second of all, it didn't actually compromise the efficacy. So based on this data, that as a physician, clinician, we feel comfortable now as starting at a lower dose, maybe 80 or 120, and dose escalate up as tolerance, knowing that it's not going to compromise the efficacy. So I think more and more, based on data, we feel more confident doing that route instead of starting at 160 milligram, knowing that some of the toxicity could be very difficult for some of the patients.